Hello, my name is Kimberly Rose, and I am going to be completing an abdominal assessment. So the first thing that I do whenever I walk into the room is do hand hygiene, and I'm going to wash my hands. And then I'm going to walk into the room and introduce myself to the patient. Hello, Mr. Rose. My name is Kimberly Rose, and I am going to be your nurse today. I am an RN to BSN student. Can you go ahead and state your name and date of birth for me?
Brandon Glenn Rose, 7/31/81.
Okay. I'm going to be completing an abdominal assessment on you today. The first thing I'm going to do is ask you a couple of questions. Have you ever had any abdominal surgeries, any problems with your bowel movements, anything associated at all with your belly?
No, to both.
Okay. And then I'm going to provide as much privacy to the patient as I can, and then I'm going to go ahead and lift up your shirt, Mr. Rose. The first thing that we're going to do is just assess and inspect the abdomen. Right now, I don't see any pulsations, no peristalsis whatsoever. The color is fine. The hair growth is normal for a male patient. I do see a birthmark right here in the right upper quadrant that I will document. Pulsations, we're looking pretty much for around the aortic region right here. And peristalsis, I do not note any, which would indicate probably a bowel obstruction or something along those lines. So after a thorough inspection, the first thing that I'm going to do is auscultate all four quadrants for bowel sounds. His bowel sounds are very active. One other thing that I am going to listen to is for a bruit in the aortic. Which I do not hear one. One other thing that I forgot to mention that we are inspecting for is the umbilicus, making sure that there's no umbilical hernia or anything along those lines, and there is not. So the next thing that we're going to do is move to percussion. We're going to do the least invasive to the most invasive for the patient. So I'm going to percuss on all the quadrants, listening for the different sounds. In the abdomen, most of the sounds are going to be tympanic, which is because the majority of the abdomen is filled with air. Dullness can also be a sound if I'm over an organ, especially the liver. And tympanic is the dominant sound. One thing that I'm going to do in the right upper quadrant, I'm going to see if I can hear the liver. Which about right here is where I hear the dullness. So the next thing after percussion is what we're going to do is light palpitation. And I'm going to do this on all four quadrants as well. And just let me know if you feel any pain or tenderness. And I'm looking for any masses, anything like that that stands out. Everything feels normal. And then I'm going to try and palpate the liver next and do a little bit of deep palpitation. And I do not feel the liver at all. One other thing that you want to check whenever assessing the abdomen is rebound tenderness. So we're going to go into the right lower quadrant and we're going to press in and just let me know if you feel any pain at all. No. Okay. The last thing that we're going to check for is costovertebral tenderness. So I'm going to have my patient sit up and then rotate and face your back towards the camera. And just let me know if you feel any pain anywhere. All right, go ahead and lay back down. So we've completed our abdominal assessment. Before leaving the room, I, of course, would wash my hands, lift up the side rails, and ask the patient if I could get them anything. Thank you.